Hi, my name is Karen and I'm here to talk to you today about croup and how to take care of croup once your child has been diagnosed with this after you are discharged from the hospital. Croup is a viral upper airway obstruction illness. By obstruction, I mean that the windpipe or trachea has a narrowing in the upper airway. There is edema in the voice box, which is also the larynx, and the vocal cords. This usually is caused by a viral illness, such as a cold or the flu, and is characterized by a cough, a hoarse, dry cough that you will notice. A lot of people say it sounds like a seal barking, and this is called stridor. The narrowing of the airway is what causes this sound because you're pushing a lot of air through this narrow airway. When you come to the hospital, they will treat this edema with a steroid called Decadron. They will also give your child what's called a racemic epi treatment. It's medicine that's in a little tube connected to a mask, and they will deliver this with oxygen and saline, which creates a mist to help with the edema in the upper airway and help your child breathe easier. The stridor can be relieved by all these things. It can also be relieved at home when croup is not too severe. You can do a warm air humidifier in the room. Not a cool air humidifier, but you want warm, moist air. Now, dry, cold air is good as well. It will help reduce the edema in the upper respiratory tract. The way to do this, if it's cold outside, you can take them outside and let them breathe in the cold air. Just make sure your child is warm. Or you can open your freezer and let the cold, dry air, let them breathe that in from the freezer. That will also help with some of the edema. You can take them to a bathroom and turn on the shower for some more cool mist. If you don't have a humidifier, turn on the shower, steam it up, let them stay in there for about 15 minutes, which should help relieve some of the symptoms. They'll also probably run a fever. To treat the fever, you can give Tylenol, and Tylenol dosage is 10 milligrams per kilogram. The way to get your child's weight in kilograms is to take the pounds divided by 2.2, and that will give your weight in kilograms. For example, if you come up with 10 kilograms for your child's weight, then you would want to give 100 milligrams of Tylenol. You can also give ibuprofen for fever. You can give ibuprofen also for relief of the swelling that's in the upper airway. The dosage for ibuprofen is 10 milligrams per kilogram as well. Same calculation, 10 milligrams per kilogram, 100 milligrams if your child weighs 10 kilograms. These should help with the flu and comfort. Now, if this doesn't work, if your child is still having severe stridor, if you notice that when he's sleeping, you notice the sound is worse, even with the treatments that you've given him, the cold air, the cool humidified air, then what you would need to do is bring them to the emergency room because it can cause a complete obstruction, so you need to get them treated as soon as possible. Also, croup can last 5 to 6 days. So once you're in the emergency room, your child has been treated for croup. He's gotten the steroids. He's gotten the treatment. It may last for 5 to 6 more days. So you can try these home treatments as well when you get home, which will give relief. He should be running a fever. That's expected. Like I said, you can treat it. Just make sure they don't go to school or daycare. As long as they're fever-free for 24 hours without you treating it with anything, then they can go back to daycare or school. You can also give them warm fluids at home, which will help relieve the hoarseness in the throat, which is sometimes irritating to a child. So warm fluids like warm lemonade, warm tea, anything that they like to drink warm. With an infant, you could use warm Pedialyte. Try to avoid the thick fluids like milk when in the older child. Don't stop the formula, but in the older child, milk, because sometimes this can cause more of the congestion to become worse. Try not to smoke around your child. If you do have to smoke, go outside. Make sure you wash your hands when you come back in and change your clothes, because smoke can trigger increase in stridor, and you don't want that to happen. So the things that you need to look for. When you take your child home, he has been treated for the croup, and they have decided that he is well enough to go home. You want to watch him very closely for at least 24 hours. Make sure that he's getting better and not worse. If you notice that he is stridorous, that barking cough when he's asleep or at rest, then you would need to bring him back. If you've noticed that this cough is unrelieved by any of the humidifier or the cold air, then you would need to bring him back to the emergency room. If you notice that your child is having color change, as in dusky or blue, or seems restless, or looks like he's pulling to breathe, and by pulling I mean his stomach looks like it's coming in, like you can see his ribs when he breathes, pulling at the collarbone, then at that point in time you would need to call 911, because they do have things on the ambulance that can treat them prior to getting to the hospital, because a respiratory obstruction is an emergency, especially in a child. If you have any of these problems, do not hesitate to call the emergency room or your doctor. We are always here for you 24 hours a day, 7 days a week. Any problems, please feel free to contact us and take care of your child, take care of the fever, make him comfortable, and he will get over this in 4 to 5 days. If not, if it lasts more than 10 days, then you would need to take him to his regular doctor. Thank you.